We are live with Dr. Ernesto Gutierrez, who's going to be chatting with us for the next 15 minutes, answering all of your questions about stem cell therapy and autism. Welcome, Dr. Gutierrez.
Hi, thank you for having me.
Of course. So talk to me a little bit about what stem cell therapy is for families that aren't able to attend this weekend.
Okay, perfect. Yes, stem cells really what they are, and just to do the sort of shortened version, what stem cells are, really they're our own repair mechanism. So our bodies, everyone's, we repair our cells, our tissues, everything with stem cells. So when we talk about stem cell therapy, it's what we're doing here is the medical process by which we grab stem cells and we put them into specifically the areas that we want to address. In the specific case of autism, like, we always say stem cells really don't cure, they heal. So they help heal certain tissues, especially around the gut, because when what we've learned, what we've realized is that if we can start healing the gut, we obviously stop a lot of these things coming into our kids' bodies. So that's what we focus mostly on, but we also treat the central nervous system, we also treat the immune system, and the great thing is we can address all these things in a single therapy because the stem cells are biologically designed to do this.
So can it be done only in the U.S.? Can it be done in the U.S. at all?
Unfortunately, at this point, no, not in the way that we're currently doing it outside. There are still a couple of clinics, a couple of places that are doing stem cell therapy here in the U.S., mostly for orthopedic conditions and for some other things that they're treating, anti-aging and things of the sort. But really, what's going on is there's a lot of very important limitations with that kind of therapy. That's why we moved our labs down to Mexico.
So how does stem cell therapy differ from other traditional therapies? A lot of families are big on ABA and OT, so how does this either contribute or how is it different? How does it go in line with the family's protocol?
Yeah, that's actually a really good question and one that we emphasize a lot. Patients shouldn't do stem cell therapy instead of everything else. They should only do stem cell therapy in addition to what they're currently doing. And what stem cell therapy somehow does is it potentiates, it increases the results that patients are seeing from these other therapies. So whether it's ABA, whether it's the biomedical, anything that they're currently doing, our experience is that after stem cell therapy, they see better results with this. So we would never tell them to stop doing everything else so that they can do stem cell therapy. It's only useful when you do everything else. And then you will see a great increase and a great boost in the results that you're currently getting and obviously newer gains.
How can it help individuals that have brain injury?
Well, like I said, it all depends where you put the cells. So most people think that we just do IV, and when you do an intravenous infusion of stem cells, they will go to different tissues that need fixing. The problem is inside the brain or inside the central nervous system, we have something that's called the blood-brain barrier. And the blood-brain barrier is great because it's there to protect us from external things which might go in there and harm our brains. But the problem is that the stem cells cannot normally go in there. That's why we cannot regenerate and repair a lot of these damages. So when we are using the approach that we use at World Stem Cells Clinic, what happens is that we address the systemic with an IV infusion, and we also do an intrathecal infusion, which goes into the cerebrospinal fluid, bathing the brain. We don't really inject the brain or anything like that, so it just bathes the brain, and the cells find the damaged areas, the inflammation right there, and will help repair. The way they repair is they become that tissue. They get there and they start differentiating, which means that they start becoming that tissue.
Melissa says, so what exactly does stem cell therapy entail? How exactly is it done?
It all depends. There's different protocols. Really, when you talk about a generic stem cell therapy, all you're really saying is we're utilizing stem cells in a therapeutic manner. So whether we get them from cord blood donors or we get them from embryonic cells or we get them from autologous like we do, you're grabbing stem cells and you're using them in therapeutic setting. So every protocol is different. If you're using allogeneic, if you're using embryonic, you have the cells in a vial, and there's different processes, obviously, safety and how they harvest and all the tests that they need to do before they put them back. In a process like ours, we harvest from each patient. For autism, we use allogeneic for other kinds of things, but for autism, we harvest from each patient. So it also includes part of that, which is either a bone marrow aspirate, which is what we do, or a liposuction, which is what all the clinics here in the U.S. do for orthopedic conditions and for rheumatoid arthritis and things like that. And then we do the therapy, and then obviously there's certain additional instructions that we've learned are very important to put into place, like introducing changes to the environment, stimulating these stem cells to actually create new neuronal connections in the brain, and all these different things. That's why we do a 5-day process.
We have another question. How do I know if and when it's right for my family?
That's actually also a really good question, and it's part of our evaluation criteria. We don't just accept anyone who comes knocking at our door and says, like, listen, we're here. We have a whole process, and in this process we need to make sure that first and foremost that it's going to be a safe treatment for the patient, and second that we are able to create or to provide a significant health improvement. If those two things aren't met, we simply don't move forward with the treatment. And then in order for a patient to really find out if it is the right time, we always invite them to complete our evaluation process. It's complimentary. You can just log into our website, register, and you'll be sent a medical form that you can obviously fill out. It takes a couple of minutes. Our team of doctors will review it. So it's 4 physicians who review each medical form. Once we give the green light, then we move on and you have a virtual consultation with one of our doctors. All of this process is free. So up until that time, and we're able to answer your questions and really understand if it is something you want to do at this time, and if it's the best time to do it, and what we can expect, and also what the current limitations are. Because people tend to think that stem cell therapy is this miraculous thing, and I certainly wish it was, but unfortunately it also has limitations. So we need to be very clear about what these limitations are when we talk to a parent.
So for parents that are interested, where should they go to learn more, and how can they take that evaluation?
Oh, it's actually quite simple. I believe you are going to link this to our Facebook page. So there's a button right there, and they can just click it for a free consultation. That'll take them straight to our website. They can also learn a little bit more there, find out about what's going on. And like I said, it's simply a matter of applying. You just click on the button, you apply, fill out a form, and we'll take you through the entire process. And if at the end you decide you don't want to do it, it's fine. Our mission really at this point is we want to spread awareness that stem cell therapy is here, it's available, it's giving good results, but it doesn't necessarily, don't feel obligated. We find that there's a lot of people who don't inquire about it because they say, you know what, I really don't want to fill out a consultation form because I don't think I'm ready yet. But the problem is that they're not learning about it. So use this as a resource. Up until this point, all of these consultations, the evaluation, everything is free. So take care of that, find out if it's the right approach, talk to our doctors, talk to our team, talk to other parents, and make your decision. But make your decision based on the right information.
Awesome. Thank you so much, Dr. Gutierrez.
No problem. Thank you for having me.